Hello, my friends. I want to talk to you about something very important today, your Social Security and Medicare. For many of us, these programs are not just numbers on paper. They are the money that pays our bills, puts food on the table, and keeps our medical care within reach. After working a lifetime, raising families, and paying taxes, we deserve to get every dollar and every benefit we've earned. I've worked with seniors for years, and I've seen how even small mistakes, like a missing year of wages on your record or a change in your drug plan, can cost thousands of dollars over time. These are mistakes that can be prevented, but only if you take action now, before October begins. In this video, I'm going to walk you step by step through what you need to do. I'll show you how to check your Social Security statement, how to prepare for Medicare's open enrollment, what to know about cost of living adjustments, and why your legal documents and taxes matter more than ever this year. My goal is simple: to make sure you keep every benefit you've earned and protect yourself from surprises. And before we get started, I'd love to hear from you. Tell me in the comments, have you ever found a mistake in your Social Security record, or had trouble with your Medicare plan? Your story might help someone else avoid the same problem. The very first step you should take before October 1st is to sit down and review your Social Security statement. Now, I know many people assume the Social Security Administration already has everything correct, but after years of helping seniors, I can tell you that's not always the case. Even one small mistake on your record can lower your monthly check for the rest of your life. Here's what you need to do. Go to the official Social Security website and log into your My Social Security account. If you don't have one yet, it's worth setting up. Once you're inside, look for your earnings record. This is the list of your reported wages, year by year. Go slowly and carefully through each line. Did you work in 1985, 1992, or 2005? Make sure those years are showing the correct income. If even one year is missing or marked as 0, your lifetime average is reduced, and that directly lowers your benefit. Let me give you an example. Imagine you earned $40,000 in a year, but the record shows nothing for that year. That one error could reduce your monthly retirement benefit by $100 or more. Now, $100 might not sound like much at first, but over 20 years of retirement, that's more than $24,000 lost. That's money you earned, and it should be in your pocket, not left on the table. While you're reviewing, also check your estimated benefits at different ages: 62, full retirement age, and 70. Too many people guess when to retire without knowing the actual numbers. But your decision could mean the difference between a smaller check and a much larger one. For some, waiting until 70 can mean 70 to 80% more per month compared to 62. Seeing those figures in black and white helps you make the best choice for yourself and your family. And don't forget the basics: your birth date, your marital status, and your mailing address. A typo here can delay your payments or cause you to miss important notices. If you do find mistakes, don't panic. Collect proof, old W-2s, tax returns, or pay stubs, and file a correction request right away. But remember, if you wait until after October 1st, the system gets crowded with new claims and updates, and fixing even a simple error can take months. So take this step now. Think of it as protecting your paycheck for the rest of your life. The next step you need to take before October 1st is to prepare for Medicare's open enrollment season. This happens every fall, and it's one of the most important times of the year for your health and your wallet. I've seen too many seniors lose money, or even lose access to the doctors they trust, because they didn't review their plan carefully. Here's the truth: Medicare Advantage and prescription drug plans change their rules every single year. And most of those changes begin right after October 1st. If you don't check now, you may be caught by surprise. Let me give you a few real situations I've seen. A patient's favorite doctor was suddenly no longer in their network, and routine visits that used to cost almost nothing started costing hundreds of dollars. Another person discovered that their prescription drug, which had always been affordable, was moved to a higher tier. Overnight, their out-of-pocket costs doubled. And sometimes premiums quietly increase while coverage decreases. You end up paying more for less. So, what can you do right now? Start by calling your doctors and asking, will you still be in my plan's network next year? If they're unsure, that's a red flag. Next, make a medication list. Write down every prescription you take, including the dosage and how often you refill it. Having this ready will make it easier to compare plans once enrollment begins. Also, look closely at your plan's annual notice of change. By law, insurance companies must send this to you, but most people toss it aside. Don't. Sit down with a cup of coffee and read it line by line. You may find big changes hidden in the fine print. Finally, consider whether traditional Medicare plus a supplemental policy might be a better fit for you than Medicare Advantage. Advantage plans can have restrictions like prior authorizations or limited hospital choices, which may become more difficult as health needs increase. The bottom line is this: millions of seniors will be rushing to make changes once open enrollment begins. If you do your homework now, you'll be ahead of the crowd and ready to act quickly. Another step you should take before October 1st is to understand two things that affect your Social Security check every single year: your COLA, which is the cost of living adjustment, and your payment timeline. These may sound like small details, but they have a big impact on your budget. Let's start with COLA. Each fall, the Social Security Administration decides if benefits will increase to keep up with inflation. They use government inflation data from July, August, and September, and by October the numbers are locked in. Now, if inflation has been high, you may see a nice boost in your monthly check. But if inflation has been low, the increase might be very small, even though your rent, groceries, and utilities keep climbing. And here's the tricky part: Medicare premiums are also finalized around this time. So if your Part B premium goes up, it can eat away most, or even all, of your COLA increase. Some years, seniors thought they were getting a raise, but after premiums were deducted, it was basically nothing. That's why it's important to know what's coming so you can plan ahead. Now let's talk about payment timelines. Social Security doesn't pay everyone on the same day. Instead, the date depends on your birthday. If your birthday is between the 1st and 10th, you're paid on the second Wednesday of each month. If it's between the 11th and 20th, you're paid on the third Wednesday. And if it's between the 21st and 31st, you're paid on the fourth Wednesday. This matters more than people realize. For example, if most of your bills, like rent or utilities, are due at the beginning of the month, but your Social Security check doesn't arrive until the third or fourth week, you could find yourself stretched thin. By reviewing your payment schedule now, you can prepare. Maybe you'll adjust when you pay certain bills or set aside a little cushion to cover early expenses. What you don't want is to be surprised in October when you suddenly realize your check is coming later than you expected. In short, October is when both your COLA and your payment timeline are set for the year. Knowing these details before they hit helps you budget better and avoid unpleasant surprises. Before October 1st, it's also important to take a close look at your legal documents and the way your Social Security benefits are managed. Many people think once the checks start coming, everything is automatic forever. But that's not how the system works. Life changes, and if your paperwork isn't updated, it can create major delays and stress for you and your family. One of the biggest misunderstandings I see is with power of attorney. A standard financial power of attorney does not automatically give someone the right to manage your Social Security benefits. Social Security has its own rule: you must officially appoint a representative payee if you want someone to handle your benefits if you're sick or unable to. Without this, even your spouse or child may not be able to touch that money, even if bills are piling up. Imagine being in the hospital and your rent or utilities can't be paid because no one is legally allowed to use your Social Security check. That's a nightmare you can prevent right now by filing the right form. Another key document is an Advance Healthcare Directive. Medicare decisions often overlap with Social Security, and if you're ever unable to speak for yourself, you need to have it in writing who will make decisions about your care. Without this, your loved ones might be forced to go through court to get permission, which wastes precious time and adds stress during an already difficult moment. You should also review your beneficiary information. If you've remarried, lost a spouse, or had any major life change, your Social Security file may not reflect that. Survivor benefits can be delayed for months, or in some cases denied, if your records don't match your current situation. And finally, make sure your will and estate planning documents are in sync with Social Security rules. For example, your final benefit check after death doesn't belong to your estate, it's returned to Social Security. Families who don't know that sometimes spend it and end up owing money back. The reason you should do all this before October is simple: fall is the busiest season for Social Security offices and even for attorneys. If you wait, appointments and processing time stretch out for months. Handling this now gives you peace of mind and keeps your family protected. The final step you should take before October 1st is to review how taxes might affect your Social Security benefits. This is an area where many retirees get caught off guard. A lot of people believe Social Security is always tax-free, but that's not the case. Depending on your total income, a large part of your benefits can be taxable, and if you're not prepared, you could face a big bill at tax time. Here's how it works in simple terms. The IRS looks at your combined income, which is your adjusted gross income plus any non-taxable interest, plus half of your Social Security benefits. If that total is over $25,000 for single filers or $32,000 for married couples, part of your Social Security can be taxed. For couples with a pension, retirement account withdrawals, or even part-time work, it's very easy to cross that line. Let me give you an example. Suppose you and your spouse get $36,000 a year from Social Security, plus $20,000 from a pension. That adds up quickly, and suddenly up to 85% of your Social Security income may be taxable. That's thousands of dollars you may owe if you don't plan ahead. So what can you do now? First, consider filing Form W-4V. This is a short form where you can ask Social Security to withhold a percentage of your benefits for taxes, 7%, 10%, 12%, or 22%. By doing this, you spread out the tax payments throughout the year instead of getting hit with a huge bill in April. Second, take some time to estimate your income for the rest of the year. Add up Social Security, any retirement account withdrawals, pensions, investments, or part-time earnings. This will give you a good idea if you'll be above the taxable threshold. Also remember, some states still tax Social Security benefits on top of federal taxes. If you live in one of those states, you need to factor that in. And don't forget about required minimum distributions, RMDs. If you're over age 73, those withdrawals can push you into a higher bracket and increase your taxes. Finally, if you're unsure, meet with a tax professional before October. Many are already busy once fall begins, and a quick conversation now could save you thousands later. The bottom line is this: adjusting your withholdings before October helps you avoid surprises, keeps more money in your pocket, and lets you enjoy retirement with less financial stress. So, my friends, we've covered a lot. And I know it may feel like a lot to take in, but here's the truth: every step we talked about today is about protecting what you've worked so hard for. Social Security and Medicare are not gifts, they are benefits you've earned after a lifetime of paying in. You deserve to get every dollar, every benefit, and every bit of peace of mind. Let's quickly recap. First, review your Social Security statement carefully, line by line, because even one missing year of income can lower your check for life. Second, prepare for Medicare open enrollment, because plans change every year, and if you don't check, you could lose your doctor or pay more for prescriptions. Third, understand your COLA and your payment timeline, so you're not caught off guard by a smaller raise or a later check. Fourth, update your legal documents and make sure your representative payee, healthcare directive, and beneficiary information are all correct, so your family is protected. And fifth, look closely at your taxes and withholdings, because planning now can save you from a painful surprise later. October 1st may look like just another date on the calendar, but in reality, it's the government's reset button. After that date, everything slows down, processing times get longer, Medicare changes kick in, and your COLA and premiums are locked in. By acting now, before October arrives, you stay one step ahead. Think of it this way: you've worked for decades, you've raised families, you've paid your dues. Don't let simple mistakes, delays, or missed deadlines take away what you've earned. A few hours of preparation now could mean thousands of dollars saved and years of peace of mind. And I'll say this one last time: you are not alone. Millions of seniors across the country are dealing with the same worries and challenges. By taking action today, you're not just protecting your future, you're setting an example for others to follow. So please, make your list, check your records, and prepare before October 1st. You've earned it, and you deserve nothing less.